Welcome to the deep dive. Today we're taking a focused look at something hopefully you won't ever need to deal with directly with your pet, lizard venom toxicosis.
Right.
We've got some medical info here digging into the poisonous lizards found in the U.S. and Mexico and, what actually happens if a pet gets bitten.
Yeah, exactly. The main players here, based on our sources, are really two types. There's the Gila monster, that's Heloderma suspectum. You find it in the southwestern U.S., parts of Mexico too.
Okay.
And then there's the Mexican beaded lizard, Heloderma horridum. That one's mainly in Mexico, Guatemala.
Yeah.
Not really native to the U.S. itself.
Got it. So Gila monsters here, beaded lizards, mostly south of the border. Now the sources say these bites are actually pretty rare.
That's the good news, yeah. They're apparently quite non-aggressive creatures, generally speaking. They tend to keep to themselves.
Phew. Okay.
Mm.
But if a bite happens,
Yeah.
it sounds like the way they deliver the venom is pretty different.
Oh, absolutely. It's fascinating, really. It's not like a snake's quick injection. These guys, they latch on. It's a really tenacious bite, almost like they're holding on for dear life.
Ouch. Just the bite itself could cause damage then.
For sure, significant mechanical trauma.
Yeah.
And their venom glands are in the lower jaw, so they have to sort of, chew the venom into the wound using grooves in their teeth.
Chew it in. Ugh. Okay, so it's a prolonged contact thing. Not great. What's actually in this venom that's causing the trouble?
It's a bit of a cocktail. You've got kallikrein-like enzymes. One is called helodermatine. There's also an acidic neurotoxin, gilatoxin.
Neurotoxin, okay.
Yeah, and phospholipase A2. That's an enzyme that messes with cell membranes, which contributes to, swelling and tissue damage.
Right. So, okay, let's say the worst happens. A pet owner suspects a bite. What are the immediate signs? What should they be looking for?
Well, the big one is sudden, really intense pain. You'll likely see it right at the bite site.
Makes sense.
Often it's on the face, maybe the lower lip, just because of how pets investigate things. And here's a really key sign, almost pathognomonic, they call it. The lizard might still be attached.
Oh, wow. Yeah, that would be a dead giveaway. A horrifying one, but
Yeah.
still. What about when they get to the vet? What might the vet see?
Okay, so on examination, you probably see bleeding from the bite, obviously. Low blood pressure, hypotension is common. That extreme pain we mentioned is usually very evident.
Yeah.
Swelling happens too, but interestingly, it often develops a bit slower than, say, with a rattlesnake bite. It's not quite as immediate or dramatic sometimes.
Slower swelling. Okay. Anything else?
Yeah, you might see excessive drooling, maybe tearing up, sometimes increased urination or defecation. In cats, sometimes they lose their voice, become aphonic, and the wound itself can look a bit bluish.
Bluish, okay. And blood clotting. Is that an issue like with some snakes?
Generally, no. Coagulopathy, problems with clotting, seems pretty rare with these lizard bites, which is one difference from certain snake envenomations.
Okay, that's useful to know. So, differential diagnoses. If you're in that area, what else might look similar initially?
Well, you'd think about just plain trauma, maybe other types of animal bites or simple puncture wounds. When comparing to venomous snakes, again, the lizard bite often has more like crushing or tearing damage from the bite itself.
Right, the chewing action.
Exactly. And you typically don't see the same kind of severe bleeding or clotting problems you might associate with rattlesnake venom, for instance. Snake bites often look like cleaner punctures, too.
And standard tests like blood work, imaging,
Yeah.
are they helpful?
Not hugely diagnostic for the venom itself, no. The clinical signs are more key. But an ECG electrocardiogram, that could be important for checking for any heart rhythm issues, arrhythmias, which can sometimes pop up.
Gotcha. Okay, immediate treatment, lizard attached. What's the safe way to remove it? Definitely don't just pull, right?
No, absolutely not. You'll just cause more tissue damage. The advice is to try and gently pry the jaws open, maybe use a thin, blunt instrument very carefully. Or try pushing something gently into the back of its mouth. Sometimes briefly applying a flame under the jaw might make it release. Or if it's on a limb, submerging the lizard and the limb in warm water can work.
Okay, several options there.
Yeah.
Once it's off and you're at the vet, what's the inpatient care look like?
Monitoring is key, especially blood pressure. Treating hypotension with IV fluids is often necessary. Managing the bite site itself involves maybe flushing it with lidocaine for pain relief.
Lidocaine, okay.
Then probing carefully for any broken teeth left behind, need to get those out. And soaking the area, perhaps with something like Burrow solution, helps keep it clean.
And pain control must be a big part of it.
Oh, definitely. These are painful. Strong pain relief, often narcotics are needed initially, and broad-spectrum antibiotics are usually given to prevent secondary infections.
Makes sense. Are there any treatments that are usually avoided? Things not to do?
Yeah, generally, corticosteroids aren't recommended or seen as helpful. And antihistamines, they don't really do much against this type of venom.
Good to know. So after the initial crisis, what's the follow-up?
You'd want to keep monitoring the heart rhythm with ECGs for a bit, just in case. And, of course, carefully watching the bite wound as it heals, making sure no infection sets in.
Okay, so summing up. Gila monster. Mexican beaded lizard bites, thankfully rare, but potentially very serious. Key signs are that tenacious bite, intense pain, maybe swelling. Getting prompt vet care is crucial.
Absolutely. That's the main takeaway. And, just thinking about it, this whole mechanism, the tenacious bite, combined with specific stuff like gelatoxin and that phospholipase A2,
Yeah.
kind of makes you wonder, doesn't it? What else could we learn by studying these venoms more closely? Maybe insights into neurotoxins or how inflammation works. It's interesting that these sort of slow-moving lizards pack such a complex punch, chemically speaking.
Yeah.
Might hold some surprising answers.